It seems that, first of all, would you like to comment, please, on my observations that society, at least in the southwest, Lagos southwest, where we're broadcasting from, you've observed that parties are back to normal every weekend, all sorts of mass events are going on. What do you think accounts for this? Because nobody sounded clear that everything is clear now, you can go back to your lives.
Yes, but that's because right from the outset, when there was a lockdown, it was only mainly Lagos and Abuja that even observed these things. So the other parts of the country never did. And when they did so in isolation, isolated places. So it's true, people have already thrown caution to the winds. And that's because also the economy of Lagos depends so much on private enterprise, events and things like that. And I think people are very wary of going in and saying, stop this, because people in Lagos like to party, they like to go for week keepings and things like that.
But
so
people in Lagos, I would imagine, also like to be alive.
They want to be alive, but let's start from the beginning. Do people really believe there was COVID in the first place? That's the first thing. Most people have doubted the origin, the presence of COVID, and that's why each time we talk about vaccination, the first thing that comes to my mind is testing and maintaining the same things we have been doing, physical distancing, masking up, washing our hands, and things like that, and staying away from large crowds. Now, testing, in most parts of the world, testing should come before vaccination. We should be having free testings in pharmacies, in hospitals, all over the country. So if you have these symptoms, you go straight and get tested. In fact, in a company like this, in universities, students should be tested on admission. Mm-hmm. Every month, all students in universities, secondary schools, above the age of maybe 15, should get tested. But when this testing is not done, people do not know they are positive. Some things you are treating for malaria could have been COVID. If people know that they are COVID positive, people will not be afraid. They will not take precautions. But testing is minimal. They were talking about vaccination of 2.9%.
In our parts here, it costs money.
It
Testing
costs
is not
money.
free.
Vaccination is not free either. The government is investing in vaccinations. The state government, Lagos State was doing testing free.
Is not free either.
Yeah, but the government is investing in it. Yes, it's free.
Oh, okay.
It's free.
Yeah.
But if we could pump that kind of money to vaccination, I would have loved those who have pumped the money into testing, because the myth that there is no COVID-19 in Nigeria will be broken. Once we find out that my brother tested negative positive, and my this tested positive, begin to isolate, household isolation, people will get to know that this is in the country. But when there are no testings, or where testings even occur, we even have people having fake testing results, fake test results, traveling out of the country. So we need to go back to the basics. Enforce masking and physical distancing, washing our hands, and coming against large crowds. There's no point vaccinating 50, herd immunity is 70%. 70% of 200 million is 140 million. We're not targeting 111. If after the key critical time of COVID, we could only vaccinate 2.9%. Now that people believe that COVID has left, they say it in churches, they say it in gatherings, COVID is not in Nigeria, it has left. What will be the motivation to take the vaccination?